Good afternoon. Thank you for joining for our Wednesday COVID-19 briefing for the state of Tennessee. Before I begin to talk about COVID-19, I want to revisit and continue to talk about the other disaster that our state continues to face. The tornadoes that happened earlier this month and the subsequent damage that resulted from those tornadoes. Yesterday, I received word that FEMA had approved our disaster declaration, which opens up funding, among other things, for the remaining counties that had not previously been approved. So all counties affected are now covered by FEMA. That would be Benton County, Carroll, Davidson, Putnam, Smith, and Wilson counties. And while other states are somewhat solely focused on COVID-19, we here in Tennessee continue to focus on those victims of the tornadoes, on their families, on the relief and the targeted efforts that we have put in place for victims of those tornadoes, and we will continue to do so. TEMA and FEMA and the support that the victims receive from the state and federal government, but also community support, the substantial community support that's out there. We want the people in Tennessee that are still significantly affected by the tornadoes to know that we are supporting them, thinking about them, praying for them, and substantively making certain that there is targeted effort headed and continuing to be in their direction. Today I want to address CDC funding. I'm going to give a status update regarding support for child care facilities in particular. I want to talk a little bit about the uninsured and our efforts to obtain funding for the uninsured, and for an update from General Holmes. He'll be given an update, Major General Holmes, regarding the use of the National Guard. Our case count today is 784 positive cases out of 11,796 total tests. Dr. Piercy will be able to answer further questions around specific numbers later in the question and answer period. But I wanted to make a couple comments about our testing. The CDC has pledged $10 million for states and for us to use specifically toward costs around the COVID-19 crisis. And in reviewing the guidance from the CDC, we are, at the same time that funding has been promised, we are spending on testing and on supplies for testing, on capacity for testing. And I've talked a lot about testing in the last several weeks and will continue to, because I believe that it is one of the most important things we can do to blunt the severity of the onset and the surge in cases across Tennessee. So our team has been incredibly focused on expanding testing in Tennessee so that we can have a better handle of where the virus is in our state. And I do want to report that Tennessee is a leader in many ways, but we are a leader in testing, what I would call a proportional leader in our region. So the number of tests compared to the population, the tests per capita, or in other words, we are testing more than states around us that have higher populations. So we're doing more testing than most of our neighboring states. And I say that because I genuinely believe that will help us to have a real significant impact on the severity of the surge. Yesterday, I announced that schools will remain closed until April the 24th. And what that means is that families across Tennessee will have a greater need for child care. Many of them temporarily found ways to provide child care for their children who were out of school. But we've now extended that date, and that makes that situation even more important to so many families. So the Department of Human Services has deployed $10 million of emergency response and recovery grants for existing child care facilities across our state to provide the needed services to make sure that children are cared for safely in this new COVID-19 environment. But we also have asked for and have had a lot of response for folks standing up childcare in this state. So if a church or a gym or a nonprofit wants to open an emergency temporary childcare facility here in Tennessee, especially if they're opening childcare facilities for healthcare workers, grocery store clerks, and those that are needed to be on the front lines in our community, then they can do so by requesting within the Department of Human Services. Can go online with Tennessee Department of Human Services, make your request, and we are trying to accommodate rapidly the ability of expanding child care services across the state. We've also heard that many existing facilities are having trouble staying open because they don't have access to cleaning supplies that make it that allow them to practice their hygiene and to provide a safe environment for children. And so I have directed the Department of Human Services to personally reach out to each existing child care facility in the state, and we will help you organize, and we will organize to secure those needed supplies for you. So if you're a child care provider, or you know a child care provider who is struggling to find the needed supplies to keep their center open and safe for kids, please reach out to us. We will make sure that we address that. I've had a lot of questions about the concerns about Tennesseans who may have to deal with costs associated with COVID-19 who are uninsured. So I have directed our Department of TennCare to make a request to CMS, the Center for Medical Services at the federal government, for a waiver to allow us to have Medicaid dollars to be used for serving those Tennesseans who currently are not covered by health care, and that we know that as this moves through the state, we'll have health care needs. The status of that is incomplete, but I wanted to give an update because it's such an important issue, and I want you to know how hard we're working on it. I've spoken myself just yesterday with the director of CMS in Washington, expressing the need for this and reiterating the details of our proposal and asking for any information they might need. I've also spoken with our Senators Lamar Alexander and Marsha Blackburn, who are working very hard to help us get this done as well. So we feel encouraged about that. We want to try to make certain that we can provide access to health care specifically related to COVID-19 for every Tennessean. I want Major General Holmes to come up in just a minute, but we announced yesterday the National Guard has activated a number of folks around the state. I'll let him give comments on specifically what those Guard members are doing, but I'll give a couple more comments here and then we'll open it up to questions. I just want to say thank you. There's a lot of folks out there in Tennessee that are doing exactly what they need to do. I want to encourage every Tennessean to take your own personal responsibility to help save the lives of your neighbors. This is a healthcare crisis. People are getting sick. People are dying in Tennessee. We have lost some of our fellow Tennesseans already, and we will lose more. We need to all remember that we can talk about statistics and data and testing and assessment and resources, but we're talking about people's lives and people's health and the safety and protection of our neighbors. We need folks to help. We need folks to do their part. And I want to give a shout out to the amount of donations that have come in for personal protective equipment. We are pursuing avenues that we're very hopeful about the prospects of acquiring the kinds of PPE that we need in this state. But part of that, one of those avenues, is to ask for donations. We have had, as the dental clinics have closed down and outpatient surgery centers have closed down, doctors, dentists, clinicians of all type have come forth and donated PPE supplies to the National Guard Armory. We're very grateful for the cooperation, and we ask for every healthcare professional to find those practices and those places that they know of that have protective equipment that could desperately be used by our healthcare providers, and to bring that forth. And I'll say too, companies, many companies have come forth, not just with innovative, creative, technical ways in which they can help, but with donations as well. The construction industry has, in large part, in a very big way, multiple companies across that industry are providing equipment and supplies, masks and such, that will be very helpful. And remember too, that's about protecting the lives of the healthcare workers that are helping protect the lives of our neighbors. Even heard a group, a sewing group that used to meet together, and these ladies now are independently meeting, staying home by themselves, but they stay connected to each other, and they're sewing masks and mask covers in their homes, and then having them donated to the to local officials. So everyone can help, everyone can engage, everyone can be a part of this, and together we will overcome it. Major General Holmes, if you would come up and make a few comments about our Guard efforts, and then we'll open it up to questions.
Yes, sir. Thank you, Governor. So as the Governor announced yesterday, we've mobilized 250 soldiers and airmen within the Tennessee National Guard. That includes a large contingent of medical specialists that ranges everywhere from combat medics all the way up to providers. There are also approximately 100 general support soldiers and airmen. And they'll have a specific role to basically be flexible as logisticians. They can be couriers. They can adapt to virtually any type of mission. And I know the Governor mentioned the tornado response. We've been deploying our guardsmen since March the 3rd, literally 6 hours of daylight before we put our first boots on the ground. And we're continuing that. We still have 75 that are completing debris removal operations in Wilson County. That's scheduled to be complete in the next 3 days. Processes for deploying soldiers are very systematic. We alert, we mobilize, and then we deploy to areas of operations. We are currently in the mobilization phase. So the current force structure we have now, they're at a mobilization site in Smyrna. And the mobilization site, they undergo special training that's specific to the areas and the missions that they'll be conducting. They'll be equipped, and then they will be dispatched and deployed to the areas of responsibility. We began actually alerting our soldiers and airmen early last week. We always take an aggressive posture in trying to predict any possible missions that may arise. And we have done that. We started out initially alerting 50 soldiers and airmen. We rapidly increased that to 150, and then we made the decision, the Governor made the decision on Sunday to go to the 250 mark. And that's just simply in response to the upward trajectory of the possible needs. We cannot afford to wait on the sidelines. We have to go big, we have to go early, and we have to be there before the need arises, and we're doing exactly that. So I know that this is going to result in some possible questions in regards to our mission. So I need to be very clear on that. Our mission is a humanitarian mission. It is not a law enforcement mission. Our guardsmen will always report to civil authorities, in this case, Department of Health, and they will do that in every instance. We'll not be conducting any law enforcement missions of any kind. As the Governor mentioned yesterday, I want to reiterate and thank our employers. It's truly a partnership. We rely on that partnership for our soldiers and airmen ability to serve their state. We recognize that it is a hardship in many cases. We also recognize the criticality of some of our soldiers, specifically our medical providers within the industry and the hospitals and the clinics. And we are not pulling them out of the civilian sector role. And we will not do that because we realize it's going to take both efforts. As exemplified by the volunteer spirit, we also have 1,000 other soldiers that are standing by and ready to mobilize. And I'll tell you, we have 12,883 soldiers and airmen in this state, minus those that are deployed. I'll not get into those numbers, but every last one of them will be willing to deploy in any area and do any mission that's required of our state. So the National Guard is a perfect example of a military force that is tailored to support in domestic operations. We're community-based. We're already familiar with our first responders down to the state, from the state level all the way to the local level. These are citizens that are serving citizens. They don't have to deploy from a remote base, station, or camp. They deploy from their readiness centers, which are in all the counties throughout Tennessee. They simply pack their gear and they deploy. We are also in contact daily, multiple times a day, with the Department of Defense and all the respective agencies from the Air Force and the Army, including the National Guard Bureau. We continue to monitor, we continue to share information. We look at all assets regardless if they're federal or state. If that were to occur and we do need assets as a federal entity, those forces will be brought into the state and they will still work under the direction of the governor. I will stop there and then subject to questions,
Great.
sir.
Good. We'll open up the lines for questions, and I want the questioners to know that we have members of our unified command team here, so Department of Health, TEMA, Department of Military, and directors. So any questions that you have that you want to direct to them as well, just know that they're in the room. So why don't we open up the line for questions?
At this point, we'll open up for questions. First, we'll go to Jonathan Matisse with the AP. Jonathan, your line is unmuted.
Hey, Governor. So your office said today that under the executive order on non-essential medical procedures, that would cover elective abortions. I was wondering, how do you define elective, and what are there any sort of enforcement components to that? Like, do you expect to go and check and make sure that these are not, these procedures aren't happening?
Yeah, so the executive order certainly was crafted in order to provide personal protective equipment. That's what that that executive order was established for. It provided for the suspension in healthcare facilities across state for non-elective surgeries, so that we could preserve the supplies necessary to serve those that are sick and potentially at risk of their lives. And it's very important that we do that. So that's the reason we suspended non-elective surgeries. Your question is specifically about non-elective abortions, and those would be like any other non-essential procedure. They would be treated the same, and my expectation and my belief and certainly my expectation is that no non-essential procedures would be performed in the state during the crisis and during this time when we need all of those supplies to be used on the front lines of protecting citizens.
Next, we'll go to Eric Hilt with News Channel 5. Eric, your line is unmuted.
Hi, Governor. My question is, why is the Department of Health numbers being reported different from the locally reported numbers? For example, here in Nashville, the Metro Public Health Department reported 253 positive cases yesterday, but today the Department of Health still reporting 188 cases. And following up on that, is that a lag that we should be expecting in all counties, not just some of the larger ones like Davidson?
I'm going to let Dr. Piercy answer that. She knows more about that data.
Thank you for the question. As we actually discussed yesterday, you're exactly right. There is a lag in reporting, and you will see a disclaimer on our website that says we report every data, every piece of data that we have by 2 p.m. every day. So I would caution you to actually expect some local numbers to be ahead of ours, but please be reassured that we will get those in our numbers, but there may be a lag.
Next, we'll go to Sergio Martinez Beltran from Nashville Public Radio. Sergio, your line is unmuted.
Good afternoon, Governor, and thanks for answering our questions today. Yesterday, the Governor of Kentucky announced that someone in his state tested positive after attending a, quote, coronavirus party, and he described it as a group of young people coming together. Is this something you worry will happen in Tennessee? Do we know if one of our cases have been because of a coronavirus party, and also what can the state do to stop young people from coming out?
Yeah, I don't know if there was anyone in our state at that party, and so we don't know anything about the specifics of either that event or whether that produced a case in this state or not. And I will say this about about gatherings. That's how people contract this virus, right? So this group of young people went to a party, and now some folks have it. And as you know, young people are not excluded from risk in this. I don't know. I read a story about one young person for sure that was maybe somewhere around 20 years old, I believe, that lost their life in this country. I don't have that in front of me, but I do know that young people are not excluded. It certainly doesn't affect them as much as the elderly, but they're not excluded, and it's very important that they take it seriously. And I will say this too about Tennessee. Our data, we've tested 11,000 folks. Now we have the numbers, 784 positive cases. We, in our state, are disproportionately testing positive for young people. So I think it's part of the reasons that some of our more densely populated cities have put on more restrictive social distancing rules, because they recognize that the concentrations of what's going on amongst those young people in dense population areas is a problem. So I don't know about the particulars of that case, but I know it brings to light the reality, and it causes it's a stark reminder that ignoring the guidance and ignoring the suggestions and being unwise in gathering with friends and doing things that you know have been purported to be dangerous with regard to the spread of the virus, it's real, and it's costly, and it's about the health and safety of our Tennesseans and our neighbors. So we strongly encourage folks to follow guidance and keep each other safe.
Next, we'll go to Joel Ebert with the Tennessean. Joel, your line is unmuted.
Hey, Governor, thanks for answering questions. The U.S. Census Bureau says that 5.6% of Tennessee's population is Hispanic or Latino, so that's about 382,000 people. There's also 15,000 or so Kurds living in Nashville. I'm curious, why hasn't the state published or shared widespread any information in Spanish or other languages on them?
Yeah, that's a good question. Dr. Piercy, you want to answer that? The data would be shared broadly through public health, I would guess. Hold on, Joel.
Thank you for the question, Joel. If I'm understanding you correctly, you're asking about cultural sensitivity, which we value highly at the Department of Health. At the local level, we have the ability to translate all of our educational materials and all of our clinical care into dozens of languages. We have multiple health departments that have one or sometimes two or three interpreters on staff, specifically for our Spanish-speaking population, and we have full-time capability for language line and all translations of our patient materials. So we value cultural sensitivity highly.
Next, we'll go to Nancy Ammons with WSMV. Nancy, your line is unmuted. Nancy, are you there? So you had raised your hand. Okay. We will proceed to the next one. We'll go to Andy Scher with the Times Free Press. Andy, your line is unmuted.
All righty. Can you hear me?
Yes, sir.
All right. I think, Governor, the Hamilton County Medical Society, which is comprised of doctors, has reached out to you folks and trying to find out exactly how much of the $150 million that you would secured from the General Assembly for COVID-19 response might be going out to various local, COVID response efforts. And they're saying they're short of some key equipment and that sort of thing. Is there a chance of any of that $150 million going for some of this needed equipment?
I think that the 150 will be spent all over the state in multiple communities. That we have put together a unified command team here that is in the process of, this has just taken place a couple days ago. We're in the process of establishing a line of communication between our unified command team and local municipalities and counties and the governments associated with those. I spoke with yesterday, had a conference call with the largest counties and cities in our state to talk about that communication line so that we would understand exactly what their needs are and could coordinate efforts. So the answer is yes. Those dollars will be spent in multiple communities all across the state. The vehicle for that has not been put in place, but the assimilation of information and requests from communities has already begun. So, and really, there's a broader conversation too, because as we know, the federal government is about to, or hopefully they are about to give us some guidance on federal funding that will give us more opportunity to understand what funds are needed to meet the needs. But you can be certain that every community and every county, and Hamilton County for certain, certainly will be part of the funding that's distributed for COVID-19. And by the way, as you recall, in our budget in the General Assembly, in our revised budget, the governors, when we proposed to the General Assembly, which they accepted, we initially had $100 million. Besides the $150 million in the COVID emergency fund, we have pushed $200 million specifically directed to counties and cities. Every county and every municipality in Tennessee, through a grant process, through the Department of Finance Administration, will receive funding totaling $200 million across the state. So those funds will come directly to the local county and those cities, and they have discretion on how to use it within particular guidelines around infrastructure and COVID-19. But there's a couple of sources of funding from the state that are coming to your community and to every community.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is unmuted.
Governor, I'm curious, where on the spectrum are we of getting so much medical supplies that some of the smaller clinics in rural Tennessee can start to get more supplies that they've asked for? In my conversations, they're continuing to see a need there. And just a follow-up of a yes or no question, I didn't know the answer and people have asked us. For people that are working part-time or have had their hours significantly reduced, are they able to get unemployment in any capacity at this time?
I'll get an answer for you for that. I don't know the particular regulations around unemployment, but I'll have that answer for you for our briefing tomorrow, so that we can get that out to folks. With regard to supplies, we actually and if any of you want to make a particular comment about that from the Unified Command Team, but we had in our briefing this morning, we talked about those supplies and how they're being distributed. We want to have an understanding. We want rural counties to have an understanding, for example, of how many of our suppliers are going to rural communities, and actually they are already being distributed to rural counties. We are, because of the Unified Command's establishment of a communication link between each county, their local TEMA representative, their local health official, and their governmental agency. When we connect a county to this Unified Command, then we can make certain that where the need is for supplies, we can get those supplies out there, and that is already happening. And as more supplies come in, then there'll be a push out further of supplies to rural communities and rural hospitals. And we are actually looking to utilize rural hospitals as the need for hospital beds ramp up. We have a strategy for that. We're developing a strategy for that, and our rural hospitals are going to be an important part of addressing this as the virus spreads.
And finally, we'll go to Stephen Elliott with the Nashville Post for the last question. Stephen, your line is unmuted.
Governor, thank you. We've seen a few seemingly isolated cases where groups are ignoring or disobeying some of your executive orders about large gatherings or various other things. Have you considered any enforcement mechanisms?
Well, Stephen, we talked about that today. We certainly want people to know that we have enforcement capacity, and if guidance or specific executive orders are ignored, then we'll use that enforcement where it's appropriate. We certainly want to let people know that, hey, you're defying guidance here, and it's actually very serious. I think sometimes part of the challenge is people taking this seriously and believing that we're serious about it. I want Tennesseans to know we're very serious about it. This is about, once again, I've said it before, but I'll say it over and over again. This is about Tennesseans who will get sick and Tennesseans that we will lose as a result of this sickness. And when this sickness can be mitigated, the spread of it, the rapid nature of it, and consequently the challenges to our healthcare system because of rapid spread, when it can be mitigated by behavior, we are serious about that behavior. And so, yes, we've had conversations in our office about specifically what that's going to look like, and talking to law enforcement about what that might look like out in counties, and we want to, where folks don't comply, we want to enforce. But here's what I would say, I hope that we don't have to get into the enforcement business in Tennessee, and that Tennesseans will actually step up and be Tennesseans and do what we inspire them and challenge them to do. I mean, that's why we're going to accomplish this. That's why we're going to get through it, because the vast majority of Tennesseans are complying. They are staying home when it's appropriate. They are not gathering. They are finding out different ways, creative, innovative ways to worship, and different ways to purchase, and different ways to socially connect, and different ways to, help the elderly stay in their homes by delivery and connection to those elderly in different ways than walking in the door and visiting them. Tennesseans know how to do that. We all know how to do it. And for the most part, it's happening. But where there's a disregard for life in this state, we will enforce.
That's all the time we have for questions today. Governor, would you like to make a closing statement?
No, not any more than what I just said about the importance of this and how important it is to us, how serious we are. And we're grateful for most of you out there who are taking this very seriously. We're going to get through it. We're very encouraged. A lot of positive things happen. We will try to report that information to you every day. We'll be back tomorrow to give an update, and we appreciate you being here today. Thank you.